remains the biggest risk factor. A new breakthrough at-home blood test could potentially help to spot the disease sooner.
Leading dementia expert Professor Kath Mummery joins us now. Kath, thank you for coming in.
Thank you for having me.
It's always fantastic when you come in because we get a lot of callers. Lots of people need your advice and help. So we'll go straight to the phone lines.
Absolutely.
We've got Michael on line first. Hi there, Michael.
Good morning, good morning.
Morning. Thank you for calling in. What's your question for Kath?
Well, I'm in the entertainment business. I'm a comedian. That's what I do for a living. And all of a sudden, it became rather difficult to remember it. So I went and got tested, and my GP informed me I got dementia. So simplifying it, that's where we're at.
OK, well, I'm really sorry to hear that, Michael. And obviously, with your profession, I'm guessing that feels like it's affecting you in very particular ways. Is there anything that's worrying you that we can try and help with?
Yeah, well, very much so, because memory is memory, you know. Thankfully, everything at home is fine, the children, grandchildren, my wife, etc. But the comedian, I forget my lines, yeah. Okay. It's not so much forgetting them, it's remembering them.
Yes,
because forgetting them is one thing, and if you've got a 5-minute sequence, which happens, you know, and you're into it, and all of a sudden 2 minutes disappears. Well, that's how it started. I thought, well, and everybody said to me, "How do you remember all that when I did my stuff?" You know, 108 laughs in 12 minutes.
Well, yeah, because it's a big skill, isn't it? Being able to remember all of those things.
Yeah.
There are things you can do, Michael, to try and make it easier. I mean, I know with being a comedian, the timing is everything and getting those lines right. But there are strategies that you can use to try and ease the burden on the memory right then and there. And there are certain experts that can help you with that. So, for example, getting strategies or tools from a speech and language therapist who helps with how to make communication easier without you having to remember things in the same way. That might be something that could help you. What's important is you said that everything else is working well. Is that right?
Yes, family life, you know, and I've got children, some adults and some younger ones, because I've been married twice.
So I think that's really...
Grandchildren
Sorry, you
grandchildren
finished.
as well, so we're kept on our toes because there's 2 or 3 generations of children as well. My wife is a head teacher, so there's plenty of dialogue. It's not a very quiet house, so one learns with that, really.
Well, that's also a really, really good thing in terms of trying to keep your brain as active as possible. Having those generations of people will make sure, especially the little people, will make sure you're very active. Having your wife, who's a teacher, I'm sure she's expert in some of these communication things and can help as well. But what I would say is, what's so important is, apart from that difficulty, which I know is important to you in terms of the lines, a lot of things there are working really well. That's going to stay for a long time. So I think playing to your strengths and making sure that this doesn't take over everything you worry about is really important. And enjoying those things that are still really, really good is super important. But coming back to speech and language therapy, if you want to find out about some experts, I'll ask the programme to let you get in touch with me afterwards, and we can see if we can find somebody that can help you, if that would be useful.
Yeah, that's just a minor thing. My wife is a head teacher, believe me, proud of her profession. And believe me, she's a very, very bright lady. So she keeps me on my toes in all sorts of ways, you know.
She sounds excellent.
Yeah, she is, yeah, she's wonderful. You know, and my children as well, they know Daddy's got a problem, but they're all adults now, and they deal with it, even the grandchildren, you know.
And that's exactly right. Talking about it together and just taking it as part of life and not being frightened of it, I think, is really important. So you're doing a terrific job.
You are.
But thank you so much for ringing in.
Yeah, and stay in touch, Michael, because we'll make sure you get some of the names of some of those people that might be able to help.
Yeah.
Thanks for calling in.
OK, next up we've got Sarah. Good morning, Sarah.
Yeah, hi, good morning.
Hi, Sarah. What would you like to talk to Kath about?
So my mum has vascular dementia and she's had it for over 6 years. And I'm just like concerned really that I might get it, and obviously my sisters as well. And I'm just trying to find out the best way to try and reduce. I've heard that you can, you know, prevent yourself from getting it, and there's ways you can reduce it. And I'm just trying to find out basically what those are.
Sarah, that's a really good question because there's so much that you can do and I don't think people realise. So 45% of dementia is preventable if you modify your risk factors. And what I mean by that is, especially when you're talking about vascular dementia, a lot of the problems that lead to that are related to problems with your blood vessels. And so what's good for your heart is good for your brain. So your blood pressure, your cholesterol, if you've got diabetes, if you smoke, those things are all bad for your heart and bad for your brain. So all of those things you can manage better will reduce your risk, especially in vascular dementia. But then there are other things that significantly reduce risk. So exercise, making sure that you get regular physical exercise 3 times a week, get out of breath, that's a good plan. Second thing is mental exercise. Doesn't have to be a brain game. It can be anything that you really enjoy, that stretches you, that makes you feel like you're doing something new. Whatever works for you. It can be many different things. And finally, your diet. Diet is really important for vascular dementia, but for all sorts of dementia. You want vegetables, lots of fresh food, avoid processed stuff, avoid too much sugar. And those things together will really help in terms of trying to reduce that risk of you getting any form of dementia, not just vascular dementia. I hope that helps a bit.
Yeah, that's great. Yeah, certainly something to look at.
Yeah.
Absolutely, Sarah. I think it's all about lifestyle as well, and a healthy lifestyle.
Yeah.
Thank you for calling in.
Thanks for calling in. Right then, we've got Maria on the line. Hi there, Maria.
Hi.
Hi, thank you for calling in. Now, what's your question for Kath?
Well, basically, I'm only, coming up to 46 in July. For some reason, I do think I have, signs of dementia. I'm so forgetful. My words, I get them so muddled up. I am due to have an MRI scan next week, but I'm just really worried at my age.
Yeah. Are you a carer as well, or you're a carer for 20 years? You were saying that you've seen some of the signs in your patients in some of your behaviours as well, Maria.
No, that is correct, yeah.
Right.
So I'm just a bit worried, at my age, but...
OK. Sure, and it is very worrying when your memory isn't working quite as you want it to. But there are many reasons for why that might happen. And at 46, the one that's least likely is that this is a form of dementia. OK, so the first thing to say is that that is really, really unlikely unless you've got people in your family in their 40s who have developed dementia. But that said...
OK.
Sorry? Sorry.
OK, yeah.
OK. So that's the first thing. But obviously, if your memory is a problem, then we need to understand why. And there are a number of different things that can cause that difficulty. Firstly, as we were just talking about, if you've seen people with memory problems and then you notice something in yourself, sometimes that can make you think, oh, there's something wrong with me, when it's not as difficult as that. It might just be that you've monitored it and thought, well, why is my memory falling down? Everybody's memory falls down every now and again, but as soon as you monitor it, you start to notice it more and more, and that makes people worry. The other things that can cause difficulties with memory and with other functions are if you have problems with anxiety or if you have any difficult things that have happened in life. Your brain can show those things in things like memory. It's very vulnerable to pressures on individuals. I'm not going to ask you whether there's anything that's been affecting you, because it's a very personal thing and we can do that separately. But I think the important thing here is many things that are treatable and reversible can cause memory problems, and this is very unlikely to be a dementia. Having the MRI scan next week is terrific. I'm pretty confident it's going to come back as normal, but it's important that you have it. But I want you to try not to worry too much, and when you get that scan, hopefully it'll reassure you.
Fingers crossed, Maria.
Yeah. OK, thank you very much.
Thanks for calling in.
Kath, couldn't that be menopause as well? She's 46.
No, that's a really good point.
Right? It might be, right?
It's a really good point, and menopause, can cause problems with your memory. I mean, I remember myself, I got problems in the middle of meetings I was having. I suddenly couldn't remember people's names. It was awful.
Yeah.
And that was the menopause.
Yeah.
So, yes, you're right. I think if somebody has developed physical symptoms that suggest menopause and their memory's a problem, definitely the two could well be linked. And hopefully when you get assessed, and I'm thinking she's probably getting an assessment because she's had an MRI scan of the brain, people will think about that.
Yes.
What I do think is not done well enough and we need to do better is teaching people what happens in menopause. I'm glad you raised it, and how to mitigate for that.
Yeah. Yeah. Thank you so much for coming on the show, Kath.
Lovely.
Gosh, the time flies.
I know it does, always, every
Really
time.
important.
Thank you very much.
Thank you. Still to come, Lisa will be heading back to the studio with her best fashion finds from the January sales.
And coming up after the break, he's making a delicious and healthy pasta dish that will help you on your way to 5 a day. Jamie Oliver's back.